Well, a recent report says that heart attacks for people under the age of 45 have risen an incredible 30%.
Ooh,
Wow.
that's a huge number.
Yeah.
As more and more millennials hit that age, what can they do to protect their hearts? Erica Olson talks to a heart expert to find out on today's Morning Mix.
Good morning. Millennials have it tough. Juggling careers, young kids, and aging parents at the same time leaves very little time for self-care, let alone protecting the most important thing of all, the heart. As February is American Heart Month, what better time to talk about millennials and heart health? So joining us today is Dr. Raed Bargout from Dignity Health. Doctor, good morning.
Good morning, Erica. Thank you for having me.
Thank you for being here. When it comes to millennials and heart health, it seems like we're adding to an already overwhelming plate. Why should we be talking about this right now? What are some misconceptions?
Well, the biggest misconception is that heart disease is an older people problem, while in reality, the foundation for heart disease being laid off usually at a young age, in our 20s and 30s. So millennials should be mindful of the risk factor that they have to prevent heart disease later on.
Prevention is key. For women, for millennial moms, some might just not be able to get to the gym. What are some practical ways that they can still be healthy without doing that?
Well, my first tip is to be mindful of those sugary drinks, processed food. Those are risk factors. The stress that they have. Exercise is important. It doesn't have to be a formalized workout. Any of this will reduce the risk of having later on heart disease.
Doesn't have to be a formalized workout. That's a really good reminder. Let's talk about stress, especially for women. Oftentimes, millennial women are the primary caregivers of both generations, their kids and their parents. So why should we be concerned about stress?
Stress is a risk factor for heart disease. It increases inflammation, increase the risk of blood pressure. All of that can increase the risk of cardiovascular disease. You cannot eliminate the stress from your life, but you can modify it. You can adjust, adapt to it. Listening to music, for example, meditation, any of that will reduce the stress, as well as a good quality sleep.
That's key. Finally, what's one piece of advice that you would give to someone who's just feeling really overwhelmed right now?
Well, you can start with the small steps, as we mentioned about the diet, exercise, even small, like 15, 20-minute exercise is important, and prevention is important as well. You have to know what's your cholesterol level, if you have hypertension, if you're diabetic, any of that is important. We at Dignity Health in both Los Angeles and San Bernardino have a 24/7 heart health care as well as cardiac rehab.
Thank you for being here this morning, Doctor.
Sure.
For more information, go to dignityhealth.org/SoCal/heart. For the Morning Mix, I'm Erica Olson. Back to you.